For today's class, we will continue our discussion of the primary structures of the digestive system by talking about the pharynx and the esophagus. The pharynx is the scientific term for the throat, and this is a tube-like structure that's made of muscle and also lined with a mucous membrane. The pharynx is located behind the nasal cavity and the mouth. Interesting to note that the pharynx is both part of the digestive system and also the respiratory system. So for the digestive system, food passes through the pharynx as it travels toward the stomach. And then for the respiratory system, air has to pass through the pharynx in order to get to the lungs. The pharynx is divided into three anatomical components. You have what's called the nasopharynx, the oropharynx, and the laryngopharynx. And these are named according to where they are located, with the nasopharynx being located close to the nasal cavity, the oropharynx being located close to the mouth, and the laryngopharynx being located close to the larynx, or your voice box. So moving further down the alimentary canal from the pharynx, that leads us to the esophagus. And the esophagus, this is a muscular mucus-lined tube that connects the pharynx with the stomach. This mucus is important, and it's created from glands in the mucosal lining. And this mucus is what helps to keep that tube lubricated so that it's easier for food to move to the stomach. Along with the mucus lubricating the food on the way to the stomach, there's also a contraction of the muscles within the esophagus. And these contractions, they have a special name. These contractions are called peristalsis. And peristalsis, by definition, is a series of wave-like motions made by muscle contractions in the digestive tract. And the point of this peristalsis is to further help that food move through the process of digestion. So let's take a look at the illustration here. You can see that as the muscle contracts, this is going to close off the esophagus and push the food or push that bolus down. Then the muscles are going to relax, which allow the passageway to open so the food can continue to move. But it's this constant rhythm of muscles contracting and muscle relaxing that helps to move that food down the esophagus into the stomach. Now there are some disorders that can result within the esophagus as a result of some problems with what we call a sphincter. Okay? And one of those such disorders is called gastroesophageal reflux disease. So gastro tells you it has something to do with the stomach, and then the esophageal lets you know that this is something that affects the esophagus. And what happens with GERD is the stomach acid contents are being regurgitated or being kind of brought back up into the esophagus, and that shouldn't happen. That stomach acid should stay in the stomach, and the way it stays in the stomach is by having this sphincter, which is called the lower esophageal sphincter, to have it closed. When it's closed, it's not going to allow those stomach contents to go up into the esophagus. However, when the lower esophageal sphincter isn't able to close properly, it creates this backflow of acid and stomach contents into the esophagus, and this is what causes symptoms such as heartburn. It can also cause a sour or bitter taste in the mouth, and it can even make it harder to swallow. And this illustration here shows you what a normal stomach and lower esophageal sphincter would look like versus the same structures in the presence of GERD. So how is gastroesophageal reflux disease, how is it treated? One way is to try to avoid things that can trigger or exacerbate symptoms of GERD. And this can be like avoiding things like chocolate. Chocolate actually has an ingredient in it that relaxes smooth muscle in the lower esophageal sphincter, and by those muscles relaxing, it's not going to close like it should. Also avoiding other foods like peppermint, coffee, citrus, or acidic foods, fried fatty foods. Okay. Also stopping smoking, as smoking can worsen GERD because the nicotine from tobacco, like the ingredient in chocolate, also relaxes the lower esophageal sphincter. Other treatment options include antacids. Antacids work by neutralizing the acid that's in your stomach, and then also not lying down within 2 to 3 hours after eating, because when you're full, this can cause food to kind of go back up into the esophagus and lead to those symptoms of heartburn. And that concludes our discussion today of the pharynx, the esophagus, and GERD.